Akram. So Akram sir is an educationist and a healthcare professional. You have seen his journey as it was being shown, with years of experience across several roles in India, Malaysia, and Australia. Academically offers support to healthcare professionals who wish to upscale their careers by migrating to Australia or other countries, setting new standards by providing professional courses for the most advanced global healthcare exams. We offer you guidance, resources, and an unwavering support. Okay, let's talk about the founder and CEO. So as you all know, Dr. Akram is an esteemed clinical pharmacist, distinguished professor, and accomplished research scientist with an impressive 15 years of teaching and research experience. Sir always had a determination, as he was telling you in the video, to help the healthcare professionals across the globe so that they can achieve their dream of moving abroad. And that is what made him to start Academically. Through his initiative, we just started off with pharmacy, and now we are catering to medical doctors, dentists, nurses, lab technicians, and you physiotherapists for various medical registration exams so that you can move to your own dream country. To further support the career advancement of healthcare professionals, we at Academically have launched a study abroad program for those wishing to pursue higher education abroad. So you have both the options. We'll talk about that also. Now, introducing our academic heads to you, Dr. Rini Sharma, who heads the medical courses, Dr. 𝗙𝗥𝗘𝗃𝗏, who heads the pharmacy courses. Guys, Dr. Rini serves as the medical courses academic head at Academically, bringing over a decade of medical expertise to the role. She is basically very much dedicated to the content preparation, the faculty interaction, the student feedback, and she holds an MBBS and MD degree completed in India and an MBA from Charleston Southern University. Ma'am is a distinguished researcher and has contributed to several impactful research papers and studies. Here at Academically, as I told you, she oversees the development and updation of medical courses to help global doctors avail the best curriculum and study resources. These are your esteemed faculties. All of them are APC qualified as registered faculties working in Australia with an extensive experience. So they have undergone the similar struggles, the ones which I'm about. So you will be taught by all these esteemed people once you join the course with Academically. Why choose Australia? As you all can see, guys, there are lots of perks and advantages, all right, to choose Australia. As you can see, 1,85,000 visa offers is what you get. There are 6,000 plus job vacancies. Salary, the most important thing, up to AUD 1 lakh. AUD is the Australian currency. So there's a screenshot which we have added. 𝗙𝗥𝗘𝗃 is one of the very important portals. Like in India, you have Naukri.com and others. So 𝗙𝗥𝗘𝗃 is one of the portals wherein you can search for the job opportunities. So as you can see right now, there are 5,570 jobs over the 𝗙𝗥𝗘𝗃 portal for the physiotherapists, right? Now, benefits for physiotherapists in Australia, higher earning potential. So with the annual salaries that go up to AUD 1 lakh, migrating to Australia as a physiotherapist has an immensely high earning potential. As I mentioned, you all know about the great quality of life which is there in Australia, and this country is known for its high standard of living, excellent healthcare, and diverse culture, making it an attractive destination for many people. Career opportunities, as I mentioned, and you have seen the screenshot, there is a high demand for physiotherapists in Australia, along with perks such as instant PR or work visas. You have a great work-life balance, which can help you physiotherapists manage their workload and maintain a healthy lifestyle. Professional development, definitely if you talk about Australia, they are always using newer technologies and newer techniques along with the machines to help a better, patient rehabilitation to take place. So physiotherapists in Australia have access to ongoing professional development opportunities and advanced technologies, which can help them advance their skills and knowledge. And as you all know, Australia offers not only for you, but also your family. So it offers several perks to the residents, such as free education for children and free healthcare access also. So these are the benefits for physiotherapists in Australia. Now, everybody, let's come to the main target of today's webinar, which is the APC written assessment. There's one question which is always there in our mind, and I'm sure in front of you all also. Now, let me see how many of you have this question, that if you want to migrate to Australia, what is the pathway for it? Can I get quick thumbs ups on this, or maybe just an acknowledgement? Yes, thank you so much. So there are many of you all. That is why we're sitting over here. So guys, if you want to migrate to Australia and practice as a physiotherapist over there, you have to pass the APC written assessment and the APC clinical assessment. APC is the Australian Physiotherapy Council. So they have got an assessment criteria or an exam which you have to pass. Once you pass that examination, you can practice as a licensed physiotherapist in Australia. Let's talk about the APC exam, what it is and how is it conducted. So everybody, the APC written assessment is the assessment or rather the exam conducted by the Australian Physiotherapy Council. Their main motto or their main idea behind it is because all of us or you all are overseas physiotherapists for them. So they just want to know whether the qualification which you hold from whichever country you are come under the guidelines or under the patient rehabilitation checks of Australia or not. So they will basically check the competence of overseas physiotherapists and then grant them registration in Australia. And as I mentioned, the purpose of this exam is to ensure that internationally qualified physiotherapists have the necessary knowledge to practice safely and effectively within their healthcare system. Guys, exam centers, so you will be very happy to know that there are no exam centers for APC written assessment. You can sit at your home on your chair and table with your laptop or your desktop and give the examination. You do not have to travel anywhere. It is a remote written assessment, which means you can take it anywhere, including your home country, including your house. And not only once, twice, or thrice, you get the opportunity to sit for the APC exam 4 times a year, right? In the month of March, which was just conducted on 6th of March, June, September, and December. And how is it conducted? As I mentioned, it's a remotely supervised examination conducted 4 times a year. This means that a candidate from India, whichever country, can complete the written assessment from their own country. But for clinical assessment, you have to move to Melbourne and then sit. Eligibility criteria, very simple, your BPT degree and your registration. So 4 years bachelor degree in physiotherapy, and the candidate must hold the educational or qualification requirements for registration without any restriction in their own country of training. Now, what are the steps? 4 steps. Listen to me carefully. First one is a documentation process, after which you get an interim certificate. All right. That is called interim certificate eligibility assessment. So you put up your documents and everything. They'll check, they'll scrutinize, and then they'll say, yes, you are a physiotherapist with unrestricted registration. Please sit for the APC written assessment. What is cultural safety training? Within that process only, there's a small cultural safety training from Australia. That means they basically want you to know their culture. So it's that. And after this, you get an interim certificate. With that interim certificate, you can book your written assessment, sit for the written assessment, and practice as a limited registration in Australia. And after that, you give your English proficiency test, go to Melbourne, sit for the clinical examination, pass that examination, and you become a registered physiotherapist. Okay? So 4 steps. Your documentation, after which you get an interim certificate, written exam, English proficiency test for visa, I'll tell you about that also, and your clinical examination for the general registration. All right? Okay. Now, let's talk about the skill assessment requirements. What are those? Your physiotherapy degree, your transcript. What is transcript, guys? Anyone knows? Consolidated mark sheet. So all 4 years of mark sheet is called as a transcript. Then your work experience evidence, if you have, well and good. Even if you don't have, no criteria of limited work experience is there in APC. Your valid passport, your government ID proof, your passport size photograph, and your registration certificate. So after all these documentation process and your cultural safety training on the portal itself, you get an interim certificate, right? After that interim certificate, you will sit in the written exam, about which I'll talk. Then I also talked about the English proficiency requirements. Guys, you can sit for IELTS, PT or OET, any 3 of them. For IELTS, you need to score 7 band. PT, score of 65 or higher is required. OET is your occupational English training, which is minimum score of 350 out of 500 or grade B is required. If you pass any 3 of them, you become eligible to go to Australia. Now let's talk about the APC written assessment. Very simple. 1-day exam. That 1-day exam is conducted into 2 sessions, guys. One is the morning session. The other is the evening session. Morning session is for 2 hours. Evening session is for 2 hours. In the middle, you get a break of 1 hour. Okay. Now, in the morning session of 2 hours, you will get 15 case-based scenarios. the way I asked you before beginning with the webinar, this presentation, we had a questionnaire, right? When I told you a case of 6-year-old asthma patient, and then there were sub-questions. So there will be 15 case-based scenarios in 2 hours, and every case-based scenario will be having 4 questions with 4 multiple choices. One will be the right answer. So morning session, 2 hours, 15 case-based scenarios with 4 questions. So within those 2 hours, that is 120 minutes, you have to answer 60 questions, 15 into 4. Similarly, in the evening session also, 60 questions, 15 into 4. So total of 4 hours of exam with 1 hour of break, right? And total 120 questions. That's what is written over here. Minimum scoring requirement. So the total marks is 1000. You have to get an average of all the 3 subjects, CP, MXK, and Neuro. Right? You have to score an average of 500. That is the cutoff, right? In both the sessions, and then you become, an eligible APC written assessment candidate. There is no negative marking. The duration of preparation is 16 weeks with Academically. So we give you a course of 16 weeks. It's basically not 16 weeks, but you just require 16 weeks for the preparation if you prepare with us. Expression of interest. You are eligible for permanent visa, 189, 190 PR visa. You get sponsored visa, 482, 494, 491, and 407 training visa. So let's talk about the program highlights of Academically. We have an instructor-led and self-paced content because as all of you are working professionals, so we have this provision of giving you recorded lectures so that you can watch it anywhere. You can attend the classes from phone or laptop. It's totally up to you. You have one-on-one mentoring support. Your mentors are there to sit and guide you throughout. Extended access to content. Yes, even if you're not able to pass the, suppose, March examination, we give you the extended access till June, to September, to December. So you have an extended access, all right, for your multiple attempts. You have a flexible schedule. If you're working, watch the recorded lectures. If you're available, take the live lectures. Periodic webinars from industry mentors. The webinars like these, we keep on conducting. Feedback and assessment, yes. So the kind of classes you are taking up, the kind of, we have the full format, how much recording have you taken up, and our grant tests have artificial intelligence-based results, so you have AI-based results. We assist you on the tips on CV writing and cover letter generation, and the placement and visa support, definitely assistance is there. This is the fee structure, guys. In English proficiency, it's round about AUD 285 is the cost. For interim certificate, cultural safety training, and eligibility assessment, you need to pay 1364 AUD to Australian Physiotherapy Council. Written assessment is 1958 AUD, and clinical assessment is 4263 AUD. All right. This is the March 2025 success stories for all of you. So these are our recent qualified students. Many more have been added to the list. Also, there's Ravneet Bedi, Ravina Dubey. So they haven't been mentioned over here. They just came up yesterday. So recently, till now, we have this selection, this time in March 2025, who sat for the examination. I think the results were out last week. So this is our March 2025 success stories. Like all of them, I would say there was one person who gave the second attempt. Rest of them, with their profession and with their patients, they only used to study for 3 to 4 hours. With Academically, they were totally, on point with their lectures, with their PPTs, with their mocks, and they were easily able to clear the APC written assessment. Now, there's a second pathway also, guys. Suppose if you don't want to write the examination, okay, then what to do? Then you can take up this pathway, the registration pathway. All right. You have to first get a registration from UK HCPC. All right. Is my slide visible to all of you? Can you all see? Should I reshare? Just tell me, okay, whether it's moving or not. Can you see my slides changing? Anybody can please confirm? Still not? Okay. I will just reshare my screen, okay? Is it visible now? Yeah. Okay. Thank you. All right. So as you all can see, as I mentioned, these are our March 2025 success stories for all of you who had with academically prepared very well and cleared their APC written assessment. Now I was mentioning about the second pathway. Suppose you don't want to sit for the examination, APC written examination. How can you move to Australia with that? We are going to talk about the HCPC course for UK. If you want to migrate to UK, guys, you don't have to sit for the examination. Okay, HCPC is the council wherein you can submit your documents, your curriculum, and they'll scrutinize it and they'll help you with the registration process. Let's talk about this. So as I mentioned, UK after the Britain's exit from the European Union faced a lot of shortage of physiotherapists because most of the physiotherapists were from Europe. All right, and that is why these are the reasons why you choose UK. You get 24,000 skills, visas for skilled workers, 3,000 plus current openings, and you get a salary of £40,588, right? Benefits, very competitive salary, no qualifying examination like Australia. You have the other option. This is the second option which I'm telling you. Physiotherapy is a growing field with increasing demand for qualified professionals, and many physiotherapist roles offer flexible hours. So you have part-time options, you have self-employment options for a better work-life balance. Now, what is the criteria for this UK registration, everybody? You must have completed either your BPT or MPT degree. You should have 1 year or 2 years of experience, right? And you should not have been previously registered with the HCPC. IELTS is mandatory. Now they also take up TOEFL. They also take up OET for in case as per se, but all your IELTS was mandatory. So what is the process? You have to submit your documents. There's a course information form wherein you have to fill what curriculum you had, what subjects you have read, what was the number of hours, how much marks you have obtained, and you have to submit your application for scrutiny. You have to pay the scrutiny fee, £639.98, right? HCPC will assess your online application, will check with your college and everything, and they'll see whether it's authentic or not. And once you get a green flag, HCPC will say, yes, your documents are good. Please go ahead with the payment for registration. And you get a registration. Once you get an HCPC registration, you become entitled to work in UK. That's your England. All right. Now from UK, how will you move to Australia? Physiotherapist in your home country, you get a UK registration through HCPC. HCPC registered candidates can just get registered themselves to New Zealand through the express pathway. Again, you submit your documents, scrutiny will happen, registration will be done. For HCPC registered candidates, no, you have a special advantage. It's done very quickly. So you get a New Zealand registration. The only thing is you have to move to New Zealand, work for 2 years in New Zealand, and you can shift your registration to Australia. Right? New Zealand and Australia, both of them are neighboring countries. So they have this act, act called Trans-Tasman Mutual Recognition Act, through which any healthcare professional practicing in Australia can shift his or her registration to New Zealand, and anyone practicing in New Zealand can shift their registration to Australia. So you can just shift your registration after 2 years of work in New Zealand without sitting for the APC exam and move to Australia, right? So this also guidance program is being provided by Academically. So we'll give you the list of documents, we'll guide you step by step, we'll fill up your form and everything. We're going to personalized guidance with a registered trainer who has been through this HCPC process, and you get your HCPC registration. You can see why become a physiotherapist in UK, New Zealand, Australia, right? As I mentioned of UK, as I mentioned of Australia, it's the same thing. Okay, so you have got your HCPC registration. How will you get registered in New Zealand? Very simple. International Express pathway. Document submission, they will review your documents and then you can get registered. So currently holding unrestricted registration as a physiotherapist in UK, Ireland, Canada, or South Africa, you can move to International Express pathway to New Zealand. Now you get a New Zealand registration, work for 2 years over there. Australia and New Zealand have the Trans-Tasman Mutual Recognition Act, which allows any profession to have their qualifications recognized in either country. So if you're registered as a physiotherapist in New Zealand, you can apply for registration in Australia after 2 years of practice. Same process, document submission, initial review, registration. Okay, if you have any queries, I'll take up. Don't worry, don't be confused. Now, I trust Academically, guys. As you all know, we have a reputational legacy, 1,000 plus positive reviews, great, highly experienced faculty profile, high quality research and precise content, a community of hundreds of ex-students from all the spheres of healthcare profession. Academically provides constant counseling, mentorship, and motivation. And if this is also not enough, you can visit our office, and you can visit India office or Australia office to discuss with Dr. Akram and the team about your career. Media coverage, as you can see, we are featured in Farm Tutor, News Nation, Economic Times, News 18, Startuppedia, Hindustan Times, News Nation, as I mentioned, the New India, Indian Express. So sir is already a motivation and inspiration for all the healthcare professions. And we've also tied up with IMA Kerala. We have signed an MOU with them. We're featured in Outlook, Economic Times, Times of India, FarmBiz, which is one of the leading pharmacy, outdoor partner. Then we have featured with Startup Rise, Z News, Business Standard. Recently, sir has got Times Power Brand Award for his excellent contribution to this particular field. You can find us on Google. These are one of our reviews from the people who have been associated with us. You all know about our social media handles, Academically.MedCare, right? So you can just scan these, and I'll hold on for a moment. And you can follow our pages to get the recent updates and everything, every information about the ongoing, updates of all the examinations. And this is our contact ID, guys. Our email ID, our office address is corporate office address in India, Australia, right? So we would be happy to serve you. Now, as I mentioned, our team has just launched Academically Study Abroad, 𝗙𝗥𝗘𝗘 by Academically. So your pathway to global healthcare education. Suppose if you want to do your MPT outside, abroad, in whichever country you want, Academically helps you with that also. So this is our page scanner. I'm holding on for a bit. You can scan this page and you can get the information about how to move, how to study abroad, and you can join our channel for more updates for your study abroad program. Also, we have a WhatsApp channel, guys. You can join our WhatsApp channel and get all important updates, FAQs, syllabus changes, and top resources in one place. So please scan this so that you get you get all the information, you get all the updates of the healthcare professions happening outside, and you can also talk to all our esteemed industry mentors, and you can upgrade your career with our WhatsApp channel. All right. So this is it from my side. This was our presentation, which I wanted you look after with. And now I'll take up your questions. Everybody get ready with your questions. You can unmute yourself. First of all, you can raise your hands. I'll call out your names. And then you can unmute yourself and we can take up your questions. I can see many people raising their hands. 1 second. I will just take up all your queries. And we can go ahead with the questionnaire. All right. Yes. The first one is Tharu Koti Amma. Yes, Tharu, you can unmute yourself and ask your query. Tharu, you have raised your hand. Please unmute yourself and ask your query. Yes, please. Rovina, you can come up with a question. No, Rovina, TOEFL is not accepted in Australia. You only have PTE, OET, and your IELTS. Okay. All right. Any other question? I can see so many of you raising their hands. Yes, Rovina, you can unmute yourself and ask your query.
Sorry, hello. Am I audible now?
Yes.
Yeah. Hi, Sonal. Thank you for the awesome information. So I just want to know that is TOEFL accepted for HCPC registration? Because from Jan 29th, I can see from the website stating that
Yes.
TOEFL score is accepted for 100, right? The minimum score
Yes.
should be 100.
Yes.
But I got 96. So what should be the first step? Like we should get the English proficiency test passed, and then we have to apply for the HCPC registration, right? Like how it goes.
For HCPC, yes, because if you talk about the form, no, in the form there are 3 criteria. Number 1 is first is your personal details, all right. The second is your course information form, as I mentioned. Third comes your English proficiency, and then comes your professional experience. So they need your English proficiency. Everything has to be filled in detail. There's a detailed form. For APC, you do not require English proficiency. You can sit for the written assessment, and before clinicals, you can go ahead with the English proficiency.
Okay,
right?
okay, Sonal. Thank you. So the first step will be like we have to get the 100, right? The minimum 100 score, and then we can.
Then you have to go for HCPC. Yes.
HCPC. Thank you so much. Thank you for so much. Yeah.
You're welcome, Ravina. Okay, Gul, you can ask your question.
Yes, hi.
Hi.
Madam, I live in Australia and recently I got my time certificate. I want to apply for limited registration. Can you help me with this process?
Well, we are an EdTech Gul. We are not any consultancy. But as far as I know, as I would say, better you go ahead with the written assessment first and then apply for limited registration physio. So that you at least have, there's an advantage always. Because the interim certificate holders are many, but there are very less people who pass written assessment and then go for limited registration. So always, you are already segregated from the crowd. So for chances for you increase somewhat.
Okay, thank you. And one more question. Do I need to do my English proficiency test before clinical exam? Is it necessary or I can do before after registration?
Well, because you're there in Australia, so you can do before after registration. Right?
Okay.
You don't require
Thank you.
to go.
Thank you.
You're welcome. Okay, Gul, you can keep your hand down. Next, Zainab, please ask your question.
Can you hear me?
Yeah, I can. Hi.
You explained 4 steps for the upper registration. And when our limited registration is starting?
No, I explained the 4 steps for practicing as a registered physiotherapist in Australia and not the upper registration, which is somewhat similar. Yes. Talking about limited registration, Zainab, you get a limited registration. You can apply for a limited registration rather after getting your interim certificate. But the main catch over here is your supervisor. Because even if you want to practice as a limited registration physiotherapist, you need to get registered with AFRA as a registered limited registration physiotherapist, right? And for that, in that particular form, there's a clause wherein you have to mention about your supervisor who is going to supervise you while practicing as a limited registration physiotherapist. That means you first need to find a supervisor. So it's always better, like what our students do, it's always better to pass the written assessment, move to Australia, right? Because any which ways for clinicals, you have to go to Australia and then find a supervisor, get yourself registered as limited registration physiotherapist, and then, you can practice as a limited registration physio. All right? Side by side, you can prepare for your clinicals also.
Okay? That's okay. Thank you.
You're welcome. Next, Haniksa, you can ask your question. Haniksa? All right, Happy, you can ask your question.
Hello.
Yes, okay, Haniksa, yes.
Can I give English proficiency test before written examination?
You can.
And can I give PT academic or PT core?
Academic.
Okay, thank you.
Welcome. Yes, Happy, you can ask your query.
Good morning. Good evening, ma'am.
Good evening.
Can I do it here itself, ma'am, in India itself? If not Australia, India itself is not worth, ma'am.
What do you want to do in India? APC written assessment?
No, ma'am, like practicing here itself. Because in college, it is not that much knowledge, ma'am. Because teachers are not much well trained, ma'am. So where can I go for practice, ma'am?
In India?
Yes, ma'am.
Okay, so see, basically the people, why do they move abroad or Australia? Because Australia offers a great salary, huge fee waiver, huge waivers are there over there. Already, salary is very good as compared to India. In India, as a physiotherapist, you can practice anywhere in some hospital or in some community centers. You have to find the jobs and then you have to practice. Okay?
Okay, thank you.
You're welcome. You can keep your hand down. Yes, Amit, you were saying something? Amit Kushwaha? No? Okay, Arya, go ahead with your question.
Yes, ma'am.
Okay, Amit, yes. Arya, hold on for a moment. Yes, Amit. Amit, what's your query?
No, ma'am.
Thank you. Arya, what's your question?
No.
Ma'am, like as you said, after writing taking the exam from our remote area, after going to Australia, that we will be working there, right, as assistant physiotherapist. So like after reaching, we will be having the salary.
Yeah, if you'll work, you'll definitely get a salary.
So ma'am, I'm asking is that so before after writing the APC second level, after that, if I get also, can I go for MPT there?
Yes, that is why we are offering you study abroad program also. You can do your MPT, right? And then you can sit for your APC exam. You can go for your APC clinicals and do your MPT. Yes, definitely. But you can't work at that moment. Also, study your MPT. It would be a great, like it would be a lot for you. Is it not, Arya?
Yeah, that's what I'm asking, ma'am.
So
So
either you
as
go and
working as
study for MPT, right, through our EduCafe program, if you are enrolling with us, all right, or you sit for the APC exam only and you prepare for the APC exam. So if you're preparing for APC exam, clear your written assessment, go there, practice as a limited registration physio, get to know about Australia's guidelines and everything, right, and prepare yourself for clinicals, and then practice as a registered physiotherapist through your BPT degree, right? After you're done with this, then you can study for your MPT if you want, after earning some money and everything, right?
so like even with the first level also doing MPT will be little bit difficult.
They are two different things, Arya. One is your job and one is
Okay.
your study profile. So either you be a student or you become a healthcare practitioner, right?
Okay, ma'am. So like when I was talking, one person told that the study hours will be like 4 hours and working will be like 6 to 7 hours. So it will you will be able to manage it. That's why I asked.
Yeah, because there are two options, no? Part-time, full-time. If you're part-time, you'll be able to
Okay.
manage. Yeah,
Thank you.
you're welcome. Yes, yes, Rovina. Okay, Basudev has first raised his hand. Basudev, please go ahead with your question. Hi.
Okay, so my question is, I have HCPC registration already, and I was looking for an NHS job here and any jobs. So it took me 2 years, and I realized that they were not offering jobs in India. So that's why I became a student here, and right now I'm in UK. It's been 2 months. I'm studying my doubles master here. I'm doing exercise medicine, and I contacted the NHS as well as the private practitioner.
1 second, na, Basudev. Kamaldeep, could you please mute yourself? I can't hear him. Thank you. Yes, Vasudev.
Okay, so after searching for 2 months also, I find some agencies and all who are giving me jobs. So all agencies and NHS also, they were asking for at least 6-7 months of experience in UK.
Okay.
So after getting HCPC also, after having a master's in India also, in fact, after doing all these things, I've been into clinicals and academics also. It's been 3 years and more than 3 years in experience in India, and still I was not getting job here in UK. So what do you suggest me to continue with this searching NHS job or just to move out New Zealand? Because right now I'm very hopeless that I'll even get a job in New Zealand or not.
Do one thing, the best part, Vasudev, wherever you are, you have two options. All right. You apply for New Zealand registration through Express Pathway. All right.
Okay.
Because you don't have to study for that. You just have to submit your documents and all that. And since you're an HCPC registered candidate staying in Australia with your BPT, MPT degree, the chances for you getting registered in New Zealand is very simple. All right.
No, I'm not in
Once you get
Australia.
the registration, no, let me finish. Once,
Okay.
suppose you get registration in New Zealand and you can search for your jobs staying in
Okay.
UK, suppose. There's one thing. Second thing is Australia. You prepare for APC written assessment, pass the written assessment, move to Australia as limited registration physio, and then practice over there. Or maybe sit here and pass your written assessment because you don't have to move anywhere. Prepare nicely, pass your written assessment, right? Because in Australia, you have great opportunities for physiotherapists. All right, you don't have to move. Move to Australia, sit for your clinicals, and go there and practice. Because if that is the thing over there, obviously you need to move out, right? So
Because
you need to choose that
before
option
1-2 years, it was like UK. Many people were moving to UK. It was
because of
not that.
NCP.
Yeah, but
No,
now
it
Australia is
happens.
moving.
Vasudev, see, the thing is now, NHS is one body wherein it's
Yeah.
up to them. They were giving certificate of sponsorship and everything also, right? But some
Yeah.
people are getting it. There are many students who have got their jobs through NHS.
Yes,
But
yes,
it happens, it happens, it happens. But then at the same time, you have to find what is the best opportunity for you, right?
Okay.
You should not listen to what others are saying. Just do it. You can't be static. You have to do something. And then when you keep on doing, you find a way out. Okay?
Okay. Yeah. Okay. So thank you. Okay.
You're welcome. Yes, Rovina?
Yes, Sonal. So I have an MPT of in hand. Okay, can I have, like, if I'm not going through HCPC, so I'm giving another chance, another try in April. So if I'm not getting 100, then can I go for MPT in masters in Australia?
Yes.
Double. Okay. Okay. So that will be
So
a score.
with our EduCafe program, if you want to move to Australia, then yeah, you will get the assistance. Okay.
Okay. Thank you so much. Yeah.
Welcome. Okay. Yes. Happy. Your next question, please.
Ma'am, actually, I'm coming from village, ma'am, so I'm not much aware of these exams, ma'am. I joined the meeting also very lately because now only I was aware of this meeting, ma'am. So, is the experience very much required, or we can join as a beginner, ma'am?
You can join as a beginner. No experience is required for APC. Okay.
When updates of the exams, how can we check, ma'am?
I just say join our WhatsApp channel over here. Scan this happy, and you'll get all the updates for free.
Okay. Thank you.
And as far as preparation is concerned, if you connect with us, then definitely we will make you prepare for the written assessment. We have great faculties and content, and you can sit and clear the exam. Okay.
Thank you, ma'am. As I'm coming from village, I'm not much aware of these things, ma'am.
No,
But
that's
I
not
have
about
to.
the village happy. It's very, these are some things which is not very common to the people, right? So I'm a doctor myself. I also don't know about many licensure exams, right? That is why these webinars are being organized for you also, that you have an awareness about it. Okay, so join our channel and you'll get the updates. Okay.
Okay, ma'am. Thank you.
Welcome. Yes, Kiran, your question, please.
Yes, I want to ask about do we have to move to the UK after HCPC registration?
No.
No, so it's just like for example, if I get the HCPC registration, then I can move to New Zealand for the express pathway, as you mentioned. And from there, I have to on a work visa or something like that?
Yeah, you can get your HCPC registration. You can pass it on to New Zealand, and then you can search for the jobs in New Zealand. If you get a job, you have to work at least for 2 years. Only then you can shift your registration to your APC. Okay.
Okay, I wanted to ask another thing. Like, for example, if I give the written examination here in India, then do I have to move for the clinical examination to Australia, right?
Definitely, Melbourne.
Melbourne. And what visa would that be?
Visit visa, tourist visa.
Tourist visa, or yeah.
And
Okay.
if you get a sponsor for your limited registration, if you get a job or as a limited registration physio, then that's the best thing.
Okay, so as a sponsor, as a limited registration physio, after completing the written exam.
Also, because if you practice as a limited registration physio, you get to know about the every procedure, like the guidelines which they follow and everything. Clinicals is very much related to that. Okay.
Okay. Thank you.
Welcome. All right. Anybody else with a question? Kamaldeep, yes, please. Kamaldeep, ask your question, please.
Excuse me. Hello, ma'am. I am from Ludhiana, and I am preparing for APC exam.
Okay.
I have already cleared my first stage. That is, I have got my interim certificate.
Okay.
Now I want to ask, how much time does it take to prepare for written exam? I mean, I am working, and I don't have much time to study a lot. I get only 1 hour or 2 hours to study only. But I want to ask, how much time does it take if I want to prepare it the written exam till December? Can I do it in 6 months or more?
You can do it for September also. It hardly
Okay.
takes, with other students who have enrolled with us, it just takes 16 weeks maximum. There
Okay, and how can I enroll in academically?
you have enrolled for this particular webinar, no? Our counselors will connect with you for a one-on-one video counseling session, and then you get enrolled with us. Come to me. I'm gonna guide you. Okay.
And if I have completed my interim certificate, can I apply for work visa or some sponsorship visa?
You can,
after
Kamaldeep,
interim?
but you know what? I think you should first concentrate on the written assessment. We are catering to a lot of students, and every student has their own journey. So the most successful thing what we have seen is after passing a written assessment, if you go, no, then what happens? You work as a limited registration physio, you get a supervisor easily. Also, you get accustomed to the clinicals and the guidelines and everything. So clinical becomes easy for you. So yeah.
Okay. If I give the written exam in India, then I have to go for clinical assessment there only. I can prepare better for clinical assessment if I go there after written exam.
You can prepare over here also in India through online things. That's not there, but it's just that you have to go to sit for the exam in Australia. Okay.
Okay. Thank you so much.
Welcome. Any other question? Yes, Ankit. Ankit, you can unmute and ask your question. Ankit, please unmute yourself.
गुड इवनिंग
Good evening.
मैम मैं डिप्लोमा इन फार्मेसी इंडिया में कर रहा हूँ
हम्म,
और मेरे को आगे अब्रॉड बैचलर्स इन फार्मेसी के लिए जाना है तो मेरे का ये डिप्लोमा है ये जुलाई 25 में कंप्लीट होगा तो मैं क्या जा सकता हूँ न्यूजीलैंड जुलाई 25 से पहले लाइक क्रेडिट ट्रांसफर हो सके ऐसा कुछ
अंकित ये ना फिजियोथेरेपी की वेबिनार है बट आपने एनरोल किया है ना तो मेरे काउंसलर्स आपको रीच करेंगे हमारे काउंसलर्स वो प्रॉपर आपके केस स्टडी करके ना आपको 1-on-1 वीडियो काउंसलिंग सेशन देंगे फॉर 1 आवर तो आप उसमें डिस्कस कर सकते हो ठीक है
ओके थैंक यू मैम
वेलकम यस किरण योर क्वेश्चन प्लीज
Ma'am, I wanted to ask, like, do you provide help with preparing for the clinical exams also?
No, not yet. We're on the verge of starting it, but the written assessment is fully provided. Okay.
Like, for example, if I enroll with Academically and then I prepare for the written exam, how will I prepare for the clinical exam?
Not two different things.
Okay. They're pretty much similar.
Same. It's just that your patient interaction, everything has to be. Otherwise, the theory is anyways the same. We're written or clinical. Okay.
So the clinical has to be okay. Yeah. So I also wanted to ask, like, do you help with HCPC registration also?
Yes, we do.
So how do I enroll with that?
The counselors will reach out to you. No, you have joined the webinar.
Yes.
Guys, is anybody there from the team? Anyone there from the team?
Yes, ma'am. Yes, ma'am.
Okay, Surya, Rajdeep, Kiran was there. Then there were many other people. Please note down them and please reach out to them right after the webinar. Okay?
Sure, ma'am. Sure.
Sure, ma'am. Sure, ma'am.
All right. So Kiran, Surbhi is there. Rajdeep, Surya, all of them are from our team. So they'll be reaching out to all of you. All, okay?
Okay, ma'am. Thank you. Thank
They'll
you.
call you also. Okay.
Okay.
Okay. You're welcome, Kiran. Yes, Arya, your question.
Ma'am, you told that we will have part-time job as a physiotherapist, right, ma'am?
No, not part-time.
So
it can be full-time, it can be part-time, depending upon the vacancy.
So the placement will be also we will get from academically.
No, we are an edtech.
We have to find.
Yeah, you have to find. See, we will help you out to clear the exam on which you will be getting the vacancies cleared, right?
So,
okay,
like, we'll
assist you. See, we'll assist you, Arya. There are faculties who are working there in Australia, so they can guide you how to search for the jobs or something like that. But we are an edtech. We make you prepare for the exam. Okay.
Okay, ma'am. And ma'am, one more, like if we are, as you said, 1 lakh AUD is like minimum for the physiotherapist, right? That also full time.
Differs.
So like if
that's an average thing.
Okay.
That's an average.
Okay, ma'am. It's like if for part time, how much we will get?
Differs, Arya. Differs. There's my company, there's your company. I want to offer more to my physiotherapist. You want to offer less. It's upon you. Right?
So what we can't tell, right?
No, like this is the salary is something which is you can't predict any country you are there in. The average salary, what is there, is right in front of you. Okay?
Okay. Thank you.
Right, Arya?
Yeah, okay. Thank you.
Yeah. Welcome. Yes, Abhinash, please ask a question.
Hi, ma'am.
Hi.
Good evening. I just
Good
entered
evening.
the Zoom meeting. Can you please explain in brief what is academically, what can we expect from you?
Okay, you've joined in the middle, Abhinash.
Yes, ma'am.
So,
Yes, ma'am.
it's a real long webinar. So I'll just say, if you want to move to Australia, if you want to go to HCPC for UK or New Zealand, so we're gonna guide you. Abhinash, guys, anybody is there? Yeah, Surbhi.
Yes, yes,
Connect
ma'am.
with him after the webinar, okay, and explain everything about the academy.
Sure, ma'am.
Okay.
Okay.
All right, Abhinash, Surbhi will be calling you after the webinar, okay, and she'll be explaining everything in
Sure,
detail.
ma'am. Sure, ma'am. Sure.
Okay, thank you. Yes,
Ma'am,
happy.
yes, ma'am. One more, sorry, one
Yes,
more
yes.
doubt.
Yes, please.
I'm just pursuing my Master of Physiotherapy. It will be
Mhm.
over by October 2025.
Okay.
Okay. After that, I start means when will I complete, ma'am?
You can complete, see, you can prepare alongside also. Okay? Yeah. Totally depends upon how your preparation is going.
Can you explain, please, briefly, what is the process to enter into Australia?
That's what I'm saying. Surbi will be reaching out to you right after the webinar and she'll be giving you a proper detailed
Okay, sure,
discussion
ma'am.
on this. All
Thank you,
right?
thank you
Yes,
so much.
guys, also people from the team, please respond on the chat box. There are some people who want to connect with you, so please respond over there. Okay. Yes, Abhinash, thank you.
Thank you so much, ma'am. Thank you.
Welcome. Yes, Happy, your question.
Ma'am, actually, I'm studying fourth year, ma'am, BPT in Madurai. So, should I start the practice now itself, or when to start the practice for exams, ma'am? I also need some guidance, ma'am.
You should start with the preparation now only. It's okay. Because
Now
by the
itself,
time
I
you are
can.
ready for the exam, this BPT will be completed. Okay.
Okay, ma'am. So now I also need some guidance, ma'am.
We can only give you guidance once you come up to us, right? So the team will be connecting with you. Okay, Surya, please connect with Happy after the webinar. Okay. Okay, Surya.
Thank you, ma'am.
Okay, ma'am. Okay.
Okay. All right. Happy Surya will be calling you and he'll be guiding you how to get connected.
Thank you, ma'am.
You're welcome. Yes, Ravina.
Sorry, Sonal, I will keep bothering you. Sorry. Okay. So one last question. So if I want to move to Australia for double masters, is English proficiency required for that?
If you want to go to Australia, English proficiency is required for your visa, Ravina. Okay.
Okay.
Yeah.
Okay. For MPT also means for the masters.
Yeah. So again, there's one more. There's Rajdeep. You're from Study Abroad team. Please connect with Ravina. Okay.
Okay. Okay, ma'am. Okay.
Okay. Ravina, Rajdeep will be connecting with you. He's from our Study Abroad team. He'll be guiding you.
Sure. Thank you. Thank you. Yeah.
You're welcome. All right. Is there anyone else left with the questions? Rajdeep, you can please keep yourself on mute, or is it not? All right. Okay. There's one question in the chat box. Who had asked? Javeria. Okay, I've answered. Vasudev's question. Okay, Tayyab Beg. I'm from Pakistan. Here is a DPT program which I had advised to Masters of Studies Message to take exam for licensing there. No, for Masters, you don't need any licensing. Okay. Gurpreet, person have to score 7 in IELTS for each module. Overall band score has to be 7, Gurpreet. Okay. Overall has to be 7. Okay, Gurpreet. Can we complete APC written preparation in 2 months? Well, it depends upon how much you're studying. If you're studying for 20 hours or 18 hours per day, then yes, you can. You can, yeah. If you have a proper guidance, no, you definitely can. Not a problem. All right, Rovina's question is answered. Okay. That's fine, Happy, not a problem. Did I miss any question? Priyanshiba, when will the next batch start for theory? Okay, the team will connect with you, Priyanshiba. All right. Is interim required before giving exams? Yes, definitely. Interim is the key for you to book the exam. Okay, Priyanshiba. Guys, anybody please connect with Priyanshiba also. Actually, please connect with...
Sure, ma'am.
Okay, Sudhi. Yes, Robina, please.
Oh,
Robina,
sorry, I forgot to put my hand down. Yeah, we are good, Sonal. Thank you so
Okay,
thank
good.
you so much.
Thank you
Yeah.
so much. HCPC is required even if no, HCPC is not required for masters. Not at all. Hi, Tharu. Dr. Sharon, late, please join me about the details of HCPC. Okay, Rajdeep will connect with you on HCPC, Sharon. Okay, Rajdeep, please connect with her after the meeting. Sharon.
Ma'am, I'm already connected with Sharon. I think
All right.
so.
Okay, Surya, not a problem.
Yeah.
Okay, great. Okay. Thank you, Dr. Sharon. Is there scope in Australia for MPT gynecology? There are many universities which offer you this. So our study abroad team can connect with you, Tharu, okay? And they'll guide you. What's the recommendation? Which pathway is easy? Standard assessment or TTMR? The best one which you find. If you want to study, go for standard assessment. If you don't want to study, go for TTMR. That's the most simple answer. Okay, any other question, guys? Can I get some thumbs ups from your end? Everybody is quietly sitting. Yes, Abhinash. Thank you.
Ma'am,
guys.
one more doubt, ma'am.
Yes.
For English proficiency, is it required only IELTS?
IELTS, OET, TT.
Oh, okay. For physiotherapy.
The team will guide you. Don't worry, Abhinash. They'll just call you after the webinar. Okay?
Yeah, sure, ma'am. Please don't forget to make a call.
They won't. They won't. Can you provide guidance to pursue Masters in Australia? Yes, Harshini. Our study abroad team guides you for Masters. They'll be reaching out to you. Okay. Yes. Next. Who is there in the queue? Yes, Abhinash, you can lower down. Advanced physio care. Okay, please ask a question.
Hi, good evening. I'm a physiotherapist from Sri Lanka. Actually, I applied AHPRA through HCPC New Zealand and AHPRA pathway. My question is, after getting AHPRA also, do I need to do the APC exam?
Yes, APC is for Australia. If you get a registration in New Zealand, doctor, right? You have to work for 2 years and then you can shift your registration to Australia. If you don't want to work for 2 years in New Zealand, you have to take the assessment pathway.
The rules have changed, no? From
Yeah.
last year.
Earlier it was not there. I think it's changed in November 2024. Not wrong.
Yes, November 24th. Okay,
Yes.
okay. Just to confirm it. Okay, thank you so much.
Welcome. Yes, Kiran, your question, please.
Ma'am, do you help with visa pathways, visa process also?
We guide you for that, but you can discuss with this with our team. They'll be able to guide you properly. Okay.
Okay. Okay. Thank you.
Welcome. Any other question? Guys, please join our WhatsApp channel so that you get an update of whatever is being going through. Okay. Okay. Any other question? All right. So I think we're good to wind up. All right. So thank you so much, guys, for such a good welcome. And thank you so much for asking your questions. And our team would be happy to connect with you. They will be connecting with you right after the webinar. It was a great webinar indeed. And I'm sure it would have helped all of you all, right? So great time with all of you. Yes, Gaurav, your question, please. Gaurav, पूछो आप अपना question. No? Thank you. Thank you, guys. Thank you, everybody, for such a warm appreciation. It is well appreciated from our side. We'll be hosting more webinars for all of you, and my team will be reaching out to you, and we'll be happy to host you. Thank you so much. Very good night to all of you, and we'll be meeting soon. Thank you. Bye-bye. Robina, your question will be, okay, it was again.